Right now, 6.7 million Americans living with dementia sit at the center of a fierce national debate. States are rethinking senior driver rules, caught between real safety concerns and the independence millions rely on for groceries or seeing grandkids. Forget vague worries about old people driving. In 12 states, lawmakers are actively rewriting the rules for drivers like us, not by taking keys just because of a birthday. Hard data shows drivers aged 75 and older face 36.5 fatal crashes per 100,000 licensed drivers, much higher than the 22.9 rate for drivers aged 35 to 54. But here's the crucial tension. Nearly 93% of drivers over 50 already adjust their habits on their own, avoiding night driving or bad weather long before any law demands it. So why are states scrambling to update rules right now? 3 undeniable realities hit at once. Our population is aging faster than expected. Modern medicine gives clearer warnings about specific health risks like dementia, and blanket age-based rules simply don't work for seniors driving safely into their 80s and beyond. This isn't bureaucratic tweaking. It's a fundamental shift, from judging drivers by the calendar to assessing their actual ability behind the wheel. If you're over 65 or care for someone who is, this shift directly impacts your freedom, your safety, and how communities support mobility for years to come. Let's anchor this in reality with the numbers. The U.S. Census Bureau shows we're getting older fast. By 2030, over 73 million Americans will be 65 or older. That's a jump from 58 million just last year. Pause and think about your own community. That surge isn't some distant problem. Baby boomers are moving steadily into their 70s and 80s right now. Pair that massive wave with critical safety data from NHTSA. Drivers aged 75 and up face higher fatality rates per mile because of increased physical fragility, not because they cause more crashes. Their 36.5 fatality rate versus 22.9 for middle-aged drivers highlights this vulnerability. But here's what the raw number misses. Seniors are often some of the safest drivers per mile compared to young drivers. The real story is deeply nuanced, not defined by age alone. That complexity is exactly why automatic age-based license restrictions are crumbling. AARP has hammered this point. Chronological age alone is a poor indicator of driving ability. Bill Johnston, Senior Policy Advisor at AARP, put it plainly this March. Licensing policies must balance public safety with the independence critical to aging with dignity. Blanket age-based restrictions are ineffective and discriminatory. The evidence backs this up. Look at self-regulation. 93% of drivers over 50 voluntarily restrict their driving. They proactively avoid night driving, heavy traffic, or bad weather based on their own honest assessment. This isn't law, it's common sense practiced daily. Rigid age rules ignore this, treating a sharp 78-year-old who drives locally the same as someone with undiagnosed dementia. That's not safety, that's dangerous guesswork. So why the legislative push now between 2022 and 2024? It's the collision of that population boom with sharper understanding of specific medical conditions impacting driving. Dementia is the starkest example. 6.7 million seniors live with Alzheimer's dementia, and drivers diagnosed are up to 8 times more likely to crash. That's impossible to ignore. States realize focusing only on age misses the real target: drivers whose specific medical conditions truly compromise safety, regardless of age. Jonathan Adkins from the Governor's Highway Safety Association emphasized this perfectly. The goal isn't to take keys away, it's to get the right people help before crashes happen. Let's clear up misunderstandings right now. First, there is no such thing as a special senior driver license in any U.S. state. That's a persistent myth. Restrictions apply based on individual need, not age. If you need corrective lenses, that goes on any license whether you're 25 or 85. The system targets functional ability. Second, while vision tests sometimes trigger at specific ages during renewal, that's not universal senior testing. Vision is just one piece. Cognitive ability, reaction time, decision-making, spatial awareness, matters immensely. Yet formal cognitive screening remains shockingly rare in most state license renewals. Only 5 states require cognitive screening beyond vision tests for older drivers during renewal. Think about that. In 45 states, a routine renewal for someone in their 80s might check eyesight, but skip assessing mental skills vital for navigating traffic. This gap becomes alarming when Dr. Guohua Li's research shows over 70% of crashes involving older drivers happen within 5 miles of home. This isn't about reckless highway trips, it's everyday errands on familiar roads. If cognitive decline subtly impacts judgment during these drives, current systems often miss it until it's too late. This brings us to a huge rural disparity that gets overlooked. NHTSA shows 52% of older drivers live in rural areas versus 17% of all drivers. Why does this matter? Because rural America often has almost no public transportation. Buses might run once a day, if at all. Taxis are scarce, ride-sharing rarely works. For rural seniors, driving isn't a habit. It's often the only way to see a doctor or get groceries. Losing that license means isolation and declining health. Imagine needing medicine, but the pharmacy is a 15-mile drive with no bus. Forcing an 80-year-old to travel hours for renewal in a county with no DMV office isn't convenient. It's a major barrier punishing safe drivers because of where they live. Now, who actually identifies drivers who shouldn't drive due to health issues? Ideally, doctors play a key role, but the system is fractured. Only 18 states require physicians to report medically unfit patients, and just 6 shield doctors from lawsuits if they do. Doctors fear breaching confidentiality or facing malpractice suits, so many stay silent. Patients might not recognize their own decline. It's a lose-lose where safety falls through the cracks. Even pharmacists matter. In Oregon, they can report if medication side effects impair driving. Yet this fragmented approach leaves too many gaps. This fuels the core controversy, the clash between safety needs and fears of age discrimination. NHTSA reports fatal crashes involving seniors over 75 rose 26% since 2015. States with well-designed mandatory testing saw a 17% crash reduction. That saves lives. But poorly designed testing punishes safe drivers, forcing competent seniors through unnecessary hurdles. Reduced driving among safe seniors directly causes social isolation, harming physical and mental health. AARP argues blanket rules violate the spirit of the Americans with Disabilities Act. They demand precision, not prejudice. States are experimenting with smarter paths forward. Colorado launched a voluntary senior driver program with free online self-assessment tools for vision and reaction time, empowering drivers proactively. Nebraska now requires vision tests for drivers over 70 during renewal, tied to the process itself. Indiana adjusted its rules so drivers 85 plus renew in person, not to suspend licenses automatically, but to let DMV staff observe real-time indicators like steadiness or confusion. Oregon uses shorter renewal cycles for drivers 80 plus, but pairs this with driver refresher courses through AARP partnerships. The common thread? Moving from, "You're 80, so we assume you're unsafe," toward, "Let's look at your specific abilities right now." Technology offers new tools too. Federally funded pilots in Colorado and Oregon test smartphone apps monitoring for microsleeps or distraction. Gentle alerts like, "You've been staring ahead too long, maybe pull over." Companies like Toyota are building AI monitoring into newer vehicles. Garmin develops navigation aids reducing cognitive load for older drivers. Privacy concerns matter, but the goal aligns with the GHSA's philosophy: prevention through support, not punishment through restriction. Forward-thinking policies also recognize solutions need alternatives to driving. Dr. Li's finding about 70% of crashes happening within 5 miles of home is a roadmap. Pennsylvania now offers senior ride vouchers, covering $50 monthly for ride shares or shuttles. A simple, powerful idea for short local trips. Ohio's recent study found 32% of fatal senior crashes involved medical emergencies, pushing them toward better integration between medical professionals and licensing authorities. It's about the entire mobility ecosystem, not just licenses. Controversies remain intense. New Jersey's proposed law would mandate physician reporting of driving impairing conditions like dementia. AARP fiercely opposes it over HIPAA privacy risks, while the GHSA cites preventable crashes. Only 6 states protect reporting doctors, showing why mandates often backfire. They increase fear without safe pathways. Similarly, AI monitoring promises help, but raises serious privacy and insurance concerns. And rural access? Nebraska's new vision test requirement creates barriers where DMV offices are scarce. True equity means pairing stricter renewal rules with mobile testing units or transportation subsidies like Pennsylvania's vouchers. Ignoring rural geography risks unintended discrimination. What does this mean for you right now? Understand states are moving toward individualized assessments. Your renewal might involve more detailed vision checks or optional cognitive screenings as you hit your late 70s. Don't panic. Be proactive. Use resources like Colorado's self-assessment tools. Pay attention to how you feel driving. Are familiar roads confusing? Do other drivers honk unexpectedly? These subtle signs merit a chat with your doctor, not as surrendering independence, but managing health like blood pressure. Talk openly with your physician. Based on my health and medications, do you have concerns about my driving? Most welcome this. Mention driving to your pharmacist with new prescriptions. They might adjust timing or suggest alternatives. Remember, in Oregon, pharmacists can be part of the safety conversation. If you notice changes in a loved one's driving, hesitation at lights, minor dings, confusion, approach it with empathy, not confrontation. Start with, "I noticed you seemed unsure turning onto Main Street. Have you tried that free Colorado driving assessment?" It might give tips. If impairment seems significant, involve their doctor. It carries more weight than family worries. Explore alternatives early. Many communities offer free or low-cost rides to appointments. If told you can no longer drive safely, seek driver rehabilitation specialists. They assess why and explore adaptations or dignified transition plans. AARP's refresher courses focus on age-related adjustments. Taking one is smart maintenance, not decline. Looking ahead, federal pressure accelerates change. NHTSA's 2024 plan urges states to adopt medical guidelines emphasizing functional assessment over age by 2025. The GHSA tracks 12 states reviewing dementia-specific reporting laws. The ultimate vision emerging isn't restricting seniors. It's building mobility ecosystems where licensing, healthcare, and transportation services connect seamlessly. Imagine renewal processes linking a driver with vision issues to local specialists, or rural mobile DMV units coordinating with rideshare providers. Ohio's finding about 32% of fatal crashes involving medical emergencies pushes towards systems where a doctor after a cardiac episode can trigger temporary review, focused on recovery, not punishment. We've learned hard lessons since Florida's failed mandatory re-exams for drivers over 80 in 2002. We know blanket cognitive testing is impractical, but targeted screening is key. We know rural seniors can't be an afterthought, and AARP is right. Age alone is a terrible metric. But the GHSA is also right. Ignoring real risks from medical conditions like dementia affecting 6.7 million seniors is irresponsible. The path forward doesn't choose between safety and freedom. It demands policies sophisticated enough to ensure both. Individualized assessments treating seniors as capable, diverse individuals, not a monolith defined by birth year. That 8 times higher crash risk for drivers with dementia? It's not a reason to fear all older drivers. It's why states reevaluate rules to support specific individuals with compassion, so truly impaired drivers get help early, while the vast majority keep driving with dignity. Jonathan Adkins' words resonate. The goal isn't to take keys away. It's to get the right people help before crashes happen. Ultimately, this is about how we value our elders. Do we see them as liabilities or citizens deserving both safety and self-determination? The states changing laws now strive for the latter. respecting independence through smarter, fairer systems. When we support an 80-year-old with mild dementia before a crash near home, we protect them. Children by the curb, delivery drivers, neighbors walking dogs. Driving safely is shared responsibility. The quiet 93% of seniors who self-regulate understand this deeply. Reformed systems aim to honor that responsibility, replacing guesswork with grace, fear with functional solutions. Your ability to drive weaves into safe, connected communities. The push for smarter rules is fundamentally about keeping all of us safer while honoring hard-earned independence. That balance, demanding both responsibility and respect, isn't just good policy. It's how we show we truly value each other, mile by mile.